Hello, welcome to From the South. I'm Laura Prada from our Telesur studios in Caracas, Venezuela. We begin with our news. You stay with us. We begin in Venezuela. The president of Venezuela has spoken about the critical economic situation currently gripping various nations across the world, including the United States. This was said by the president this Wednesday.
We need to consider unemployment numbers in the United States. There's been almost 30 million people left without a job over the last 15 days. In Spain, there are projections of unemployment rate climbing past 20%. It's the same across the world, and it's a situation made worse by the pandemic.
And Cuba has sent a medical brigade to Cape Verde to assist the African nation in the fight against COVID-19. 5 doctors, 10 nurses, and 5 specialists in hygiene and epidemiology have left for Praia on Wednesday. Cuba's Minister of Health assured that the government has made preparations for the team's arrival. The country has so far 68 positive cases and 1 fatality. In the midst of the pandemic, Cuba has sent medical teams to help those countries that need it the most.
To represent Cuba in these moments in which it's offering its support, as always, in accordance with the beliefs of José Martí that homeland means humanity, and we fulfill this will, we are helping the world and guarantee with our actions things that cannot be done in other places. We are also sure that our families are well cared by the revolution and the Cuban health system.
Brazil remains the hardest hit Latin American country by the coronavirus pandemic. The country has reported 43,000 cases and a death toll over 2,000. Brian Meir from Sao Paulo has more details for us on the following report. Welcome, Brian.
8 of the states in Brazil's northeast region are governed by governors from left-wing political parties. And one of the most popular governors in Brazil right now is Brazilian Communist Party Governor Flávio Dino in Maranhão. Now, the governors in the northeastern states have banded together to try and work collaboratively to best respond to the coronavirus pandemic. And they've been fighting back against far-right President Jair Bolsonaro every step of the way. Bolsonaro has not just repeatedly called for an end to quarantine orders, which has been ignored by all of these governors. He's also tried to sabotage shipments of medical supplies, medicines, and ventilators to the governors in the northeastern states. So last week, after repeated attempts at getting ventilators into his state, Governor Dino smuggled 107 ventilators in from China, bypassing both United States government attempts to capture and sabotage the shipment and attempts by Bolsonaro to block ventilators from arriving in the Northeast. And today there was another victory for Governor Dino. The Supreme Court ruled that a company in Santa Catarina has to deliver 68 ventilators to Maranhão State within 48 hours. This is a shipment that was blocked by direct order from President Bolsonaro. So once again, as Bolsonaro tries to sabotage the governor's attempts to minimize transmission of the deadly coronavirus, which has already claimed over 1,700 lives officially in Brazil, the governors keep fighting back every step of the way and represent the only chance right now of Brazil's citizens to protect themselves against this deadly killer.
Thank you, Brian. That was Brian Meir from Sao Paulo. Also in Brazil, meanwhile, the intensive care unit of a Brazilian hospital that specializes in infectious diseases has been overwhelmed by coronavirus patients. Since mid-April, all beds have been occupied.
We have an occupancy rate of 100%. A bed is only released if a patient is better and leaves, or if a patient dies. So we are always at a 100% capacity because for one person who leaves, there are 100 requests.
It is incomparable with everything I have experienced so far, and yet I am an infectious disease specialist. I have seen patients with all kinds of lung diseases, all kinds of cases, tuberculosis, everything you can imagine, but nothing can compare to this. It's a new chapter in medicine that we have to write daily without knowing what the next sentence will be.
In Argentina, over 3,100 COVID-19 cases have been recorded, with 151 deaths. On Tuesday night, 8 elderly people were taken to the hospital by ambulance from a nursing home in Buenos Aires, the capital, where the country's first case was recorded. The nursing home was evacuated after the disease began to spread among residents. Family members gathered at the home to accompany their relatives to the hospital.
We managed to get them all transferred because they had no medical assistance here. 72 hours ago, they were absolutely abandoned. We don't know in what situation they actually left, what type of medication they had, how they are.
In regards to isolating them, it's difficult because it's necessary to isolate each one in a room. And it's not possible because if I have more patients than rooms while strictly complying with the building protocol, we can't. It's a factual impossibility. This situation was revealed to the Buenos Aires city government. But above all, the point was the lack of staff members. The nurses were infected. We were desperate.
Time for a first break. Remember, follow us on Twitter at Telesur English and on my account at Laura Peterson. We'll be right back with more news. Back with our news, China's National Health Commission says the country has registered 30 new COVID-19 cases, 23 of which were imported. The cases were recorded in Heilongjiang province. This takes the country's total to more than 82,700 infected. Meanwhile, more than 77,000 patients have been discharged from hospital. Additionally, the total number of fatalities stands at over 4,600. Meanwhile, China has slammed the baseless accusations of U.S. state that it failed to control the novel coronavirus. On Tuesday, Missouri filed a lawsuit that sought to hold China responsible for the economic losses caused by the COVID-19 outbreak in its territory.
These kind of accusations are absurd, without any facts or legal basis. Since the outbreak of novel coronavirus pneumonia, the Chinese government has been open, transparent, and responsible on the matter, and informed the World Health Organization and relevant countries and regions, including the United States, of the epidemic in a timely manner. China has shared the genome sequencing of the virus, actively responded to requests from relevant parties, and strengthened international cooperation.
United States is the world's hardest hit country by the novel coronavirus, with 40,000 deaths and more than 800,000 infections. Health authorities have been trying to trace the origin of the viral illness in the country. Late on Tuesday, a medical examiner of Santa Clara, California, revealed that 2 people died from COVID-19 in early February, weeks before the first officially recorded death in Seattle. Neither of the victims had a recent travel history, which points to a community spread. For his part, President Donald Trump plans to sign an order to temporarily block the entrance of immigrants, a move that he argues would protect workers' jobs. Immigration is a key issue for Trump's conservative base, which he is keen to place ahead of the November elections. He has also announced that he could stop the issuance of green cards and permanent permits for 60 days, but would expect temporary workers such as seasonal farm laborers. In Spain, Prime Minister Pedro Sánchez presented a plan to ease the country's lockdown, but although he stressed that confinement will not be fully lifted until we are truly prepared, he stated. Spain reported on Wednesday another 435 people who died in the past 24 hours, a slight increase in the figures for a second day running and bringing the overall death toll to 21,717. Spain has suffered the third highest number of deaths in the world after United States and Italy, with infections now hitting 208,000 cases. Health Ministry figures show this toll. The March 14 lockdown has been twice extended, with Parliament on Wednesday expected to prolong it until May 9th. Addressing MPs at Wednesday parliamentary session, Sanchez said move to ease the lockdown will likely begin in the second half of May, warning they would be slow and gradual and carried out with extreme caution. French government spokeswoman Sibeth Nideje said on Wednesday that cafes and hotels may not be able to resume work on June 15th, over a month after France starts easing the strict lockdown restrictions.
Our ambition is to work together. We also need time to develop the various scenarios for business to resume, so I obviously cannot confirm the date of June 15. What I can tell you, however, is that we are aware of the particular difficulties facing this sector, which will not be able to resume its activity, as the President of the Republic has indicated, at the same time as the other economic sectors, and which, as such, will need special assistance. And that is why we are currently working in consultation with the sector to have a specific plan of support and assistance for hoteliers, cafe owners, and restaurant owners.
Meanwhile, more than 1,000 people line up to collect food and essentials from a community food bank in Paris suburb this Wednesday, as lockdown measures to contain the new coronavirus have affected the poorer communities, also the hardest hit by the pandemic.
When this COVID-19 health crisis started, we saw that it was going to affect the whole population, but especially the precarious people. This is why we have organized ourselves to help families who have difficulty making ends meet and the lack of wages during this period. We thought how we could help them, so we are decided to do food distribution.
Food is too expensive. It's too expensive. Prices have doubled in the supermarket. For me, it is a little difficult with my children and my husband, who has been out of work since the beginning of the crisis. I have to come to get food, and this is my only solution.
And the head of the UN's World Food Program is warning that as the world is dealing with the pandemic, it's also on a brink of a hunger pandemic, adding that even before COVID-19 became a global issue, the World Food Program had warned world leaders that 2020 would see the worst humanitarian crisis since World War II.
This might sound truly shocking, but let me give you just some numbers. 821 million people go to bed hungry every night all over the world, chronically hungry. And as Dr. Chu just pointed out, as the new global report on food crisis that's published today shows, there are a further 135 million people facing crisis levels of hunger or worse. That means 135 million people on Earth are marching toward the brink of starvation. But now the World Food Program analysis shows also, due to the coronavirus, that an additional 130 million people could be pushed to the brink of starvation by the end of 2020. That's a total of 265 million people. In a worst-case scenario, we could be looking at famine in about 36 countries. And in fact, 10 of these countries, we already have more than 1 million people per country who are on the verge of starvation.
An agriculture minister of the G20 countries held a virtual meeting on supplies alleged to ensure sufficient global food amid the pandemic. The ministers said we will work together to help ensure that sufficient, safe, affordable and nutritious food continues to be available and accessible to all people, including the poorest, the most vulnerable and displaced people. They also said it was important that coronavirus restrictions do not create unnecessary barriers to trade and food chains. And the World Health Organization recalled this Wednesday that complacency is the greatest danger facing countries in the fight against the novel coronavirus, a pandemic that has infected over 2,500,000 people worldwide.
There is no question that stay-at-home orders and other physical distancing measures have successfully suppressed transmission in many countries. But this virus remains extremely dangerous. Early evidence suggests most of the world's population remains susceptible. That means epidemics can easily reignite. One of the greatest dangers we face now is complacency.
Time for a first per second break, I must say. Very short. We'll be right back with more news from around the world. Back with our news, Iran has successfully put into orbit its first military satellite, which reached an altitude of 425 kilometers above Earth. Iran's Islamic Revolutionary Guard Corps informed that the satellite, called Nur, light in Persian, was launched using the three-stage satellite carrier Qassed from the central desert of Iran. The launch, carried out on Wednesday, will be a great achievement and an evolution for the Islamic Republic in the space field, according with the official website SEPA News. The launch was carried out despite previous warnings from the United States, a country that has tried to paralyze Iran's scientific progress, calling the Persian country's peaceful space program a provocation. In Turkey, the Sarıyer district mosque in Istanbul has been closed for mass prayers to limit the spread of the novel coronavirus and has turned into temporary supermarkets with free food for vulnerable people prior to the celebration of the Ramadan.
After the coronavirus outbreak, we thought about what we could do for our brothers and sisters in need. And inspired by our ancestors' culture of the charity stunt, we decided to make our brothers in need and our brothers with means meet on our mosque shelves. Today is our 14th day. Our brothers with means can come to our mosque and leave whatever they want, and our brothers in need can come and take whatever they wish.
I'm really in dire need. My husband doesn't work. I used to clean houses, but since the virus, they no longer go. We have a home, but without any income, we are not doing well, as we don't have any help from social services.
Afghan Muslims are preparing for the start of the holy month of Ramadan, the month when believers fast from dawn to sunset, as they also cope with demands of the COVID-19 crisis. Most of Afghan's big cities, including the capital Kabul, are in lockdown, and religious leaders have told people to pray at home rather than at the mosque. The lockdown, which was recently extended to early May, has left many in dire straits, while some charity organizations have started distributing bags of wheat to people who have been out of work since the restrictions were applied in Kabul. The country has confirmed 1,143 cases of the virus, with 40 deaths so far, but with only sporadic testing. There are concerns that a surge in infections could overwhelm the country's war-ravaged health system.
Ramadan is coming and people have nothing to eat. The government must have some mercy on us and allow people to work at least half a day to be able to feed themselves.
Pretoria Church worked with a program to help South Africa's drug-addicted homeless amid COVID-19 pandemic. With South Africa in its fourth week of lockdown, a temporary shelter run by a church in the northern suburbs of Pretoria is looking after the country's most vulnerable. The drug-addicted homeless, the most of the 99 men at the shelter, are getting treatment for heroin addiction for the first time with a methadone administered by Pretoria's community-oriented substance use program known as COSUP. Patient numbers for COSUP have roughly doubled since the start of lockdown, as former street dealers have suffered withdrawal symptoms after being placed in shelters.
I'm actually glad COVID-19 happened because these people show us love, they're affectionate, they care actually. They say they want to plan a reintegration program for us, so I'm waiting to see what's happening.
In Nepal, the government has provided transportation to take workers from Kathmandu back to their villages after the country's Supreme Court ordered the government to take responsibility for getting laborers home. Since the lockdown began, thousands of people in Kathmandu had been trying to return to their homes districts. Far from home and without resources for food and shelter, many had started to walk in desperation.
I was trying to go home, but I couldn't because of the lockdown. But it is difficult to just stay here. I will be safe there in my village. That's why I'm trying to go home.
Ethiopia Airlines, the biggest in Africa, is facing a $0.5 billion loss in revenue amid the global crisis.
All kinds of problems that Africa has suffered, we have always stood with Africa. We have never abandoned Africa in bad times. Will we be able to sustain with only 15% of our revenue, because cargo constitutes only 15% of revenue? For a short period of time, yes. But for how long? Very difficult to predict.
Long lines of unemployed relying on free food across Bangkok, scrambles for cash handout and fishing in fetid canals. Thais are getting increasingly desperate as the pandemic destroys the economy and the government struggles to respond. Some 27 million informal workers who lost their jobs in the tourism, entertainment, food and service sectors have applied for a monthly cash handout from the government, though only half have received approval. Thailand reports over 2,800 COVID-19 cases and almost 50 deaths.
I'm a monsieur working specifically Chinese too. I've been out of job for almost 4 months and a half. The government hasn't helped me with anything or asked how I've been coping the situation. I haven't received the 5,000 baht handout either, so here I am getting free food. Some days I can't even have the 3 meals. I have waited for the government's aid, then I'll be dead first.
We are here to give our free food to the homeless, the poor and the jobless.
And North Korean students are adapting to routines as they attend lectures at the Pyongyang University of Medical Sciences during the coronavirus crisis. Earlier in April, North Korea called for stronger measures against the rapid spread of coronavirus pandemic, but still didn't report infections. North Korea called for stronger measures against the rapidly spreading of the coronavirus pandemic at a meeting presided by leader Kim Jong-un. According with the state media, without acknowledging whether the country had reported any infections, North Korea quickly shut down its borders after the virus was first detected in neighboring China in January and imposed strict containment measures. Officials in Pyongyang and its state media have repeatedly insisted that the North remains totally free of the virus. As part of its antivirus efforts, North Korea put thousands of its own people and hundreds of foreigners, including diplomats, into isolation and mounted disinfection drives. Like this, we come to the end of News Brief. Of course, you can find this and more information on our website, telesurenglish.net. Like this, we come to the end. Invitation is made for you to continue with Telesur, always together, connecting our global thousands. And next time, thank you for watching.